Hi, my name is Tessie. I'm a student at the University of Florida getting my doctorate in occupational therapy. I want to bridge the gap and provide clarity on feeding milestones from a Hispanic practitioner to families nationally and internationally. To start, reflect on this question. Do your children use the baby bottle after 12 to 18 months of age? If so, you're not alone. Throughout this video, I'll explain why it's important to transition foods and bottles for your children, the recommended feeding milestones from newborn to 36 months, and how you or a loved one can implement tips from our team at Orlando Health Feeding Difficulty Center to your table to make feeding enjoyable for everyone. Whether this is your first time learning about the milestones or not, I know it can be overwhelming. You're doing a great job caring for your children, and it's important to remember that throughout this video. Within my time at the Feeding Difficulty Center, I interviewed 9 practitioners, including occupational therapists, speech-language pathologists, gastroenterologists, a social worker, a nurse practitioner, and a dietitian to gather their perspective on the Latin influence on pediatric feeding milestones. These were the results. Latin families were often observed to provide the baby bottle from 3 to 8 years old. They often use the bottle for comfort or as a primary source of nutrition. Latin families often had a tendency to mix purees into bottles and often desired to have their child appear well-fed instead of thin. Our practitioners spoke of a strong emphasis on multi-generational households and all who may have different expectations for the child. Understanding the milestones can help you, as the caregiver, to understand your child's progress, ensuring they acquire the necessary skills to continue healthy habits. The observations from our clinicians are important, as there is value in transitioning through the milestones appropriately. By doing so, we decrease the likelihood of developing iron deficiencies, obesity, dental caries, delays in oral motor skill development, and challenges when transitioning bottles to foods. Now that we know why it's important to follow the milestones, let's dive into the age groups and the appropriate skills at each. According to many national resources, such as the American Speech Language Hearing Association, AOTA, and the American Academy of Pediatrics, your newborn to 4-month-old exclusively accepts breast milk, formula, or both. At 5 to 6 months, the child accepts breast milk and/or formula and may begin puree, cereal, or soft eggs. The child holds the baby bottle and opens their mouth for the spoon. At 6 to 9 months old, the child accepts breast milk and/or formula. If puree was previously started, the child may begin lumpy solids such as mashed arepa, mashed yuca, or mashed sweet plantain. And you can begin to introduce finger foods such as toast and pancake. The child's lips close around the spoon and they're able to drink from a straw or open cup with minimal spilling. At 9 to 12 months old, the child accepts breast milk and/or formula. Soft, bite-sized foods are introduced such as sliced banana, pasta, or cheese cubes. The child holds the spoon and closes their lips when swallowing, and they drink from an open cup or sippy cup and start to drink water. At 12 to 18 months, the child accepts breast milk, pasteurized whole milk, or water, and they feed themselves with utensils or their fingers. They eat everyday foods of soft, tender textures such as cooked meat and fish, small fruits, or softened veggie stew. And they drink from a sippy cup without help and can drink from an open cup with some spilling. At 18 to 24 months, the child accepts breast milk, pasteurized whole milk, or water. They feed themselves with their fingers or utensils primarily independently, and they eat foods that require lots of chewing, such as shredded chicken breast or pork. And they drink from a small cup with both hands and have minimal spilling. At 24 to 36 months, the child accepts breast milk, pasteurized fat-free or low-fat milk, or water, and you can introduce a combination of foods such as shredded chicken or ground beef with chopped pasta or rice, refried beans with soft tortilla or Spaniard tortilla, and they can drink from an open cup without spilling. Lastly, let's dive into professional recommendations from our practitioners. A few feeding transition tips to remember are: introduce new foods gradually, encourage your child to sit at the table with the family and smell foods, and establish consistent mealtime routines. Additionally, keep cultural traditions around food preparation. As these transitions are often new for the child and for yourself, they may become dysregulated as their means for comfort are changing. Therefore, self-regulation techniques include developing bedtime routines, using stuffed animals and blankets as comfort, and implementing movement or deep pressure techniques. And last but not least, we encourage you to ask questions to other healthcare providers, validate your child's unique developmental path, and support independent decision-making. Thank you.